Have you ever wondered what happens in your body when there are very high concentrations of testosterone? What damaging short, medium, and long-term effects can occur? Are they reversible or do they last a lifetime? Do they occur equally in everyone? Is it something that only affects men or also women? Dr. Borja Bandera here, your Spanish physician and endocrinologist. And today we explain what happens in your body when you have too much testosterone. Testosterone is the main male sex hormone, although it's produced in both men and women. Its presence is necessary to develop primary and secondary male characteristics, as well as to maintain optimal health throughout our lives. It's produced in the testes, in a group of cells called the Leydig cells, and as well in ovaries. Testosterone coordinates spatial memory and verbal reasoning, stimulates brain development, intervenes in bone maturations, as well in muscle growth and development, increase muscle strength, increase risk tolerance, but is highly doubtful that testosterone alone conditions greater aggressiveness, allows psychological characteristics such as self-esteem and confidence, increase libido or sexual desire, and testosterone is involved in sperm production and thus fertility. These are the functions of testosterone when it's in physiological normal concentrations and its production mechanism is properly regulated. In order to understand what happens when testosterone is very high, we have to understand how this hormone is produced in the first place, and more importantly, how its synthesis is regulated. How testosterone is produced and what do we need for its production and biosynthesis. The synthesis process begins in the hypothalamus, a collection of cells at the base of your brain, where the hormone GnRH, or gonadotropin releasing hormone, is released. This stimulates the pituitary gland to produce LH and FSH, two hormones. Luteinizing hormone LH is very important because it allows the synthesis of steroidogenesis regulating protein, which begins the transformation of cholesterol into androgenic steroids such as testosterone. FSH, on the other hand, stimulates sperm formation. The most important hormone in testosterone synthesis is LH. So you have already understood that in order to have testosterone synthesis, we need a well-functioning hypothalamus, a well-functioning pituitary gland, and a well-functioning testes or ovaries. An important fact is that part of the testosterone we produce daily is converted into estrogens by a process called aromatization and carried out by the enzyme aromatase. When there is too much aromatization, we can develop feminine traits or even gynecomastia, which is the presence of mammary glandular tissue in the male. As aromatase is expressed in adipose tissue, when we have a high percentage of fat, we also have higher aromatization of testosterone, and this is why obesity and gynecomastia are closely related. In addition, approximately 10% of all testosterone is converted to DHT, dihydrotestosterone, by the enzyme 5-alpha reductase. DHT is even more androgenic than testosterone and is a major factor in the appearance of birds, hair in the male areas, or a deep voice. However, to the surprise of many, it has less power to hypertrophy muscle than testosterone has. Having very high concentration of DHT is associated with increased risk of prostate cancer and androgenetic or androgenic alopecia. Of the testosterone generated, a part has been converted into DHT and another into estrogens. And what remains can be divided into free testosterone, which accounts for 2% and is ready to bind to androgen receptors. The effect produced by a free testosterone molecule when it binds to its androgen receptor depends on where in the body it binds. For example, if it binds to a receptor in muscle, it will stimulate muscle protein synthesis. But if it does in the brain, it will do another thing completely different. Protein-bound testosterone is the other part and accounts for 98%. Most of it binds to two proteins, SHBJ and albumin. If we have a lot of SHBJ, we will have less bioavailable testosterone ready to exert its action in the tissue, even if the testosterone in the blood test is normal. That is why it's important to calculate the free fraction and bioavailable fraction of testosterone when we do a blood test. The free fraction plus the one bound to albumin is called bioavailable. which is the really useful part of the total testosterone that is circulating in your blood. For the synthesis of testosterone, we need therefore cholesterol, diets very low in cholesterol related to less testosterone, so very low calorie diets relate to lower concentration and synthesis of testosterone, sufficient carbohydrates. In the long term, a ketogenic diet may decrease synthesis. Adequate sleep, several weeks sleeping 2 hours less than necessary, decreases testicular volume. Absence of testicular toxins such as alcohol, a healthy hormonal environment and metabolism, healthy testicles, and a healthy pituitary and hypothalamus. Side effects caused by too much testosterone. How much is too much? We normally produce an average of 5 to 10 milligrams of testosterone per day in the testes. Women produce much less, around 1 to 2 milligrams per day. The normal range in men is between 300 and 1000 nanograms per deciliter, while in women it's between 20 and 70 nanograms per deciliter. This is the normal, healthy, physiologic testosterone concentration. However, in people who use testosterone for sport or aesthetic purposes or for performance issues, we see doses that far exceed this and which are very dangerous. In a natural way, someone who produces a lot of testosterone can produce about 70 milligrams of testosterone per week, according to what we said. The doses in bodybuilding range from 250 milligrams per week to 1 gram per week, and sometimes even more, which is an absolute nonsense. That is, we are exposing all the cells of your body to testosterone concentrations that can be more than 10 times higher than a person who naturally produces a lot of testosterone. And as you can imagine, this has its consequences. The side effects of this type of practices that you should systematically stay away from are excess of aromatization and gynecomastia. That is why bodybuilders take anti-estrogenic and anti-aromatization drugs such as tamoxifen or anastrozole, which on the other hand, and linking concepts, are also prescribed in breast cancer, since some cells of breast cancer grow after uncontrolled estrogen exposure. I remind you that aromatization is the conversion of testosterone into estrogens, mainly in the fatty tissue. Gynecomastia is the development of breast glandular tissue in the male, and is very common in bodybuilders and testosterone abusers. Increased risk of prostate cancer, since prostate cells are exposed to more DHT, because if there is more testosterone and 10% is converted into DHT, we end up having much more DHT. Higher cardiovascular mortality, which is more heart problems, and they are caused by higher blood pressure, an increased stiffness of the arteries, a decrease in HDL cholesterol, and an increase in LDL cholesterol. It is a much more atherogenic lipid profile, filling the arteries with fat faster, increased platelet aggregation and risk of venous and arterial thrombosis, fluid retention, especially in the lower limbs, and polyglobulia, which is the increase in the number of red blood cells, which makes the blood thicker and more viscous. Testicular atrophy and lifelong infertility. When we have such high concentration of testosterone, the hormones in charge of stimulating them, which I remind you are LH and FSH, decrease to a minimum. This is called overriding or abolishing the hypothalamic pituitary gonadal axis. But of course, LH and FSH have a role in maintaining testicular health and in sperm formation, and when they are not present, cell death occurs in the testes. Testicular atrophy is not a myth, it's real. Testicular volume decreases a lot in testosterone users at high doses. Erectile dysfunction and lower libido. This happens once testosterone use has stopped. The axis takes a long time to reactivate, and sometimes it's not even reactivated. So when we no longer use testosterone, but your body is not producing it either, we are in a situation when we go from very high concentrations of testosterone to relatively low concentration, and this translates into alterations such as erectile dysfunction, depressive symptoms. You will find sudden changes in mood, insomnia, and once again, this occurs during periods in which testosterone is not used. during rest periods, and this is due to the sudden drop in androgen concentration. In this sense, the bodybuilder or athlete who has abused testosterone will be in a similar situation as the patient with hypogonadism who does not have enough testosterone. Lower life expectancy. Testosterone abuse is associated with a threefold increased risk of death from any cause. This is contributed not only by increased cardiovascular mortality, but also by depressive disorders, concomitant use of other substances, or loss of the sense of risk conferred by testosterone. We have the example of Callum von Moger, who recently jumped out of a second-story window under the influence of certain drugs and with a background that reveals a number of mental health problems. Liver disease. We will have increased liver transaminases, however, this occurs to a greater extent with oral androgens rather than with parenteral androgens. Acne. It's not only an aesthetic problem, since many have more skin abscesses that become infected and can become a serious problem. More hospital admissions with respect to the general population, for the reason we are mentioning in this list, of course. Chronic kidney disease. The excess of androgens, as we have said, affects the vascular tree, your cardiovascular system, and there is no more vascularized organ than the kidneys, so these also deteriorate rapidly with the abuse of testosterone. Headaches. Sometimes they are very difficult to manage. Increased insulin resistance and metabolic problems. Drug dependence. This is not unimportant as many users of these substances end up totally addicted to the effects of these substances. They can no longer live at ease with themselves if they are not using testosterone, as when they stop using they have the side effects we have seen, such as erectile dysfunction or depressive symptoms. It's a very difficult situation that usually requires professional help. Premature aging. In the end, using any type of hormone at such high doses forces the cellular machinery and increases the aging process. So yes, you will probably look great at 20 or 30, but look at the life expectancy of most bodybuilders. With the possible exception of Arnold, most don't usually live past the age of 65. And that's why it's still used, because it works extraordinarily well for gaining muscle and losing fat. We can see up to 6 kg of muscle in 10 weeks in this intervention study using 600 mg per week of testosterone enanthate and strength training. So the debate is, should we continue to prohibit the use of these drugs for a non-medical purpose, or on the contrary, should we legalize it? Do you agree with the use of testosterone to grow muscles? In what situation do you think it will be justifiable? Leave it in the comments, I read you. So much for today's video. I hope you have learned something. If you like it, share it with your friends and family. See you soon, stay healthy and strong.